Hello, I'm Dr. Joel Gator-Warsh, and I am the owner and founder of Integrative Pediatrics and Medicine Studio City. Welcome to the first edition of the Integrative Collaboratory. I'm here with the amazing Dr. Christine Surrago. She is a naturopathic doctor, and our topic of today is what is naturopathic medicine and how can that be integrated into modern conventional Western medicine. So welcome.
Thank you.
So why don't you tell us a little bit about what integrative medicine is and what naturopathic medicine really means to you?
Okay. So naturopathic medicine is a field of medicine where the doctors in that field, they look for the root cause of disease, which is similar to what Dr. Joel also does in his practice because he's a holistic pediatrician. So we look for underlying causes, what's causing the symptoms versus suppression, which Western medicine has been known to do over a long period of time. So, yeah.
And what is the training involved in being a naturopathic doctor? Do you go to school for lots of years? I mean, I know the answer to this question, but I think a lot of people don't because in regular Western medicine and medical school, we never even hear the term naturopathic medicine.
Right.
I didn't even know what a naturopathic doctor was until I started learning about it myself. So maybe you can tell people about your training, your education, and we can go from there because I think most people don't know.
Okay, so a naturopathic doctor, you have to do undergraduate and then you go for your doctorate. So it's like a medical training for 4 years. You do have some similar training to a medical doctor. There's a few differences in terms of hours with patients and hours learning about pharmaceuticals. So that's one thing.
Where does it differ? So what do you learn that's different than a conventionally trained medical doctor?
So we learn a lot of different things. We learn osteopathic manipulation, which a lot of people know it as like chiropractic adjustments. We learn craniosacral therapy, which is a fascia release therapy. We're herbalists, so we're trained in medical herbalism, clinical nutrition, and homeopathy. And we also have some training in IVs, like some of the holistic IVs, like all the different plant constituents that are now available as IVs and vitamin IVs.
That's amazing. And I know most naturopaths don't work like primary care doctors, but some do, right? In some states, I know in California, you can, right? So you can actually be someone's primary care doctor, correct?
Yep.
And what does that look like if someone was to go to a naturopath as their physician, as their doctor versus a medical doctor?
So the naturopath can still, as like a medical doctor would, do a physical exam, order blood work, imaging, whatever they need to diagnose you, so they can give you a formal diagnosis, and if they need to refer you to a specialist, they can as well. And the treatments is where it usually varies. So like with different conditions, let's say autoimmune conditions, most of conventional medicine uses medicines that suppress the immune system for an autoimmune disease, whereas a naturopath may or may not do that. They may use diet and different herbs and supplements versus a pharmaceutical treatment. But in some cases, we would use the pharmaceuticals. So.
Okay. And do you feel like there should be more collaboration between naturopaths and Western doctors? And how do you feel like that should look? And where should we go, really, with this?
Yeah, I think there is starting to be a lot of collaboration. Like Dr. Joel and I are collaborating now. He's special. He's one of the special.
Very special.
Special medical doctor. I think that if we were able to collaborate a lot more, severe cases that end up going into the hospital and so forth that keep reoccurring wouldn't happen as much if like a surgeon or a specialist started working side by side with a naturopath, because the patient would have healthier habits that would prevent them from manifesting different symptoms again.
And to me, I wish we would work with naturopaths more. The more that I've learned about what you do and what other naturopaths do, it's so amazing, and it broadens the treatment options for patients and just the way that we think about things. And to me, at least, a naturopath is the same thing as any other specialist in medicine. It's so common and normal to send your patient to a gastrointestinal specialist or a cardiologist or an allergist or things like that for those problems. But it's weird and odd and taboo to send somebody to a naturopath for preventative medicine or to work on getting to the root cause, which I'm not exactly sure why, because you do different things than we do. You can do the similar things than what I do, but most times you do something different. You look at things from a different angle. You have a different training base, and you certainly have more education when it comes to the natural side of medicine. And somebody who spends 7 years learning about supplements is naturally going to know more about them than someone who knows they took a weekend course or they learned a little bit about it. And these medicines are not, or supplements are not benign. And so just like when giving medication, you want to go to your doctor because we have a lot of experience with that. When you go to a naturopath, you're getting someone who has a lot of experience with supplements. And that's why I feel with naturopaths, you do get a lot of successful outcomes because you have people that know what they're doing with this, and it's another viewpoint. And so I don't know, what do you think about that, and the naturopath versus the doctor?
I love that you put it as a specialist. That's how I always thought of it. And if people thought of it that way, it'd be so much better. And then maybe it would be nice if insurance covered us too.
It would, and I think it would be amazing to have that as the integrative doctor, the integrative specialist, the integrative naturopathic doctor. As, hey, I went to my physician and he did all the lab work, and my kid's coming in for stomach aches, and we've done all the normal stuff. We did all the lab work. It was okay. We did the ultrasound. We went to the stomach doctor. We did all the things that you're supposed to do, and everything came up normal. So your kid's totally fine, except that they're having pain every single day. So maybe, at least to me, that's when, okay, I've exhausted all my options. I'm not sure what else to do, but you're still having issues. That's exactly when you would send someone to the specialist. So why not send to someone who's a specialist at looking in the root cause? And I focus on this because it's my training. But generally in medicine, we don't think about things that way. And for somebody who doesn't necessarily want to do the training in integrative medicine, to me, that's the time when you send to the integrative specialist or the naturopathic doctor to look into natural medicine. And that is where I envision and hope that the medical practice goes in the future. I think as a patient, if you're looking to have really great healthcare, then I think going to a naturopathic doctor in general is good because you're going to work on prevention, maybe even more than a regular doctor would. Regular doctors do some prevention medicine, but I think naturopaths focus on that more. But it's collaboratory, and I think people would do better to have both.
I agree.
I think both sides have different fields, and there's a lot of naturopaths that maybe don't know a ton of the regular medicine, and so you probably want to have a little of both because there's a lot of amazing things in Western medicine, and sometimes when you're sick or something's going on, you do need that medication to make you better. But then you can work with a naturopath to heal your body, bring it back into balance.
I totally agree.
I don't know if you have any other thoughts or anything else you want to talk about today.
No, I think we covered it.
Maybe tell people how to get a hold of you and some information about yourself if they want to come see you.
So I'm here in Studio City with Dr. Joel. You can reach me at my website, Dr. Surrago, drsurrago.com.
And you can find me, Dr. Joel Gator-Warsh, on INTEGRATIVEPediatricsandMedicine.com, or you can find me on Instagram at Dr. Joel Gator, or on Facebook too. And you can find Dr. Surrago on all of those sites through any of my sites, and you can find me through any of her sites. We're working collaboratively here. We're seeing patients. I see mostly kids. She sees adults and kids. And if you're in Los Angeles, we're happy to see you. Give us a call. If you're somewhere else, there's lots of other amazing naturopathic doctors out there. And think about that as an option. If you're having chronic healthcare issues and you have been through everything, you've done all the medical stuff that there is, and you're not really getting answers, then think about going to someone who does naturopathic medicine, because they might have a little bit of a different viewpoint, and maybe they can work collaboratively with your physician to come up with a little bit of a different plan for you. All right, well, have a great rest of the day, and thanks for joining us on our first episode of the Integrative Collaboratory.